Everybody, we're gonna get started. Welcome back, everyone, to 2019 and these new halls for us, and to our witnesses that are here with us today. This is our first week of. Sorry, I was getting feedback here. And so in October of 2018, the House of Commons Standing Committee on Health struck a subcommittee, and this is the subcommittee. So we're looking at sport-related concussions and the opportunity to be able to make our playing fields safer for our kids, making sure that coaches and all those involved in sport are aware of the different protocols and guidelines that are out there, and looking at ways that we can make them even better. So best practices. We've had the opportunity before the new year to hear from a lot of athletes, amateur athletes, as well as their parents who have experienced concussion, and through their stories, we were able to learn a lot. Today, to all the members that we have here, and we have members from coast to coast to coast that are with us, many with a great deal of experience in sport, in medicine, that will be asking questions of the witnesses. We've got Rugby Canada, which we've heard a lot about, and then Mr. Paul Hunter will be representing Rugby Canada here today. He's the Director of National Rugby Development. And from the Coaching Association of Canada, we've got Peter Nieder, the Director of Education and Partnerships. Did I pronounce that correctly, Mr. Nieder?
It's Niedre.
Nieder.
Yeah.
Niedre?
Niedre.
Niedre.
Yeah.
Niedre. Mr. Niedre.
Thanks.
So how this is it's going to be in rotation for the witnesses, and you'll hear from the Liberals, the Conservatives, and the NDP, and each member will have an opportunity to ask you a number of questions, and you'll be able to answer. We will have to cut you when time is up with each member's questioning, but we will go around a number of times, so you will get another opportunity. We're going to start with the Liberals and Mr. Doug Ellefson.
But they present first.
Oh,
They
sorry.
present first.
Oh, sorry. Yeah. That's right. We're going to start actually with the witnesses. Yes, I'm just making it up. So we're going to start with the witnesses.
You wanted to see if we were ready.
A little rusty after the holidays here. A little rusty.
See if we were ready.
Yeah.
What did you have for lunch?
And so we can start with Mr. Peter Niedre.
Yeah. Perfect. Thank you. So I just want to thank the Subcommittee on Sports-Related Concussions in Canada and the Standing Committee of Health for the invitation for us to be here to present, and it's an honor to have the Coaching Association of Canada here. I also want to start by thanking the Public Health Agency of Canada for their initial support to help us develop our current National Coaching Certification Program Concussion Management e-learning module, Making Headway, and Sport Canada for their continued support in making sure that we're able to keep our content in the Making Headway module current. So I just want to start just a brief introduction of what we do, but coaches are a part of our entire sports system of technical leaders and administrators that work to develop and protect our athletes and participants in sport. The Coaching Association of Canada's mandate, recognized by all federal, provincial, and territorial ministers, is to lead ethically sound coaching and sport leader training, delivery, and promotion in association with other stakeholders through our National Coaching Certification Program. We work in partnership with 66 national sport organizations like Rugby Canada and 13 provincial territorial representatives as the primary partnership organizations responsible and accountable for national and provincial territorial coaching and sport leader development and our delivery of our education. I think we all know training and education are widely recognized as enabling social change. Education and training through the NCCP is widely noted in the research as having a significant impact in changing coaching behaviors in all sport contexts: community, competitive, and instructional. Through our partnership, over 60,000 new coaches enter the National Coaching Certification Program on an annual basis. And the highest percentage of our coaches taking the National Coaching Certification Program training are engaged at a community or competition introduction level. Coaches will coach across multiple sports, stages of athlete development, age groups, and skill levels. They're working on the ground with participants in practice and competition environments on a daily basis where concussions are always a risk. It is also important to understand that although there are sports that may have a higher prevalence of concussions, no sport precludes the risk of concussion. There's not one that does. Additionally, all coaches, teachers, and instructors may encounter participants who risk concussion, whether it's on the playground, municipal facilities, or in the school gym. As concussions are not exclusive to any sport in particular, regardless of high or low risk, the entire sports system, from community to high performance, is responsible for concussion prevention, detection, and management. So with support of the Public Health Agency of Canada, the National Coaching Certification Program Making Headway in Sport e-learning module was developed in 2013 as a tool to better equip and enable coaches to manage concussion through prevention, detection, and recovery. The online training was created with the expertise of leading experts Dr. Charles Tater, Dr. James Kissick, Dr. Pierre Fremont, Dr. Karen Johnson, Dr. Purcell, Dr. Mark Aubrey, and Dr. David Ellenberg, and in partnership with Parachute Canada. Making Headway was recently revised in 2017 following the 2016 Concussion and Sport Group International Conference on Concussion and Sport held in Berlin, Germany. The NCCP Making Headway module contents are closely aligned with Parachute Canada on return to play and return to learn protocols. With respect to baseline testing, the CAC and the NCCP Making Headway module recognizes the recommendations of the Federal Provincial Territorial Working Group, the International Concussion and Sport Group, and Parachute Canada in our education of material and education of coaches as we work towards a harmonized approach to concussion management. We've worked closely with Parachute and the Federal Provincial Territorial Groups to ensure a harmonized approach in the prevention and detection and the recovery and return to play from concussions. Provincial and territorial jurisdictions play an extremely important role in enhancing the National Harmonized Approach Protocol within their jurisdictions. Two specific examples that significantly enhance the harmonized approach include Ontario with the development and implementation of Rowan's Law, and in Quebec with an enhanced return to play protocol. Since its launch in 2013, approximately 52,000 coaches have taken NCCP Making Headway. We've seen an 87% increase in the number of coaches who have engaged on an annual basis since 2015. Of these coaches, over 90% are coaching at the community and introduction to competition contexts. And through our survey that we do at post e-learning, 88% of those who have surveyed have indicated that they are more confident in handling concussions with their athletes after taking and managing concussions after taking NCCP Making Headway. So just in closing, I've had the incredible opportunity in my career to work in the school and sports system for over 20 years. As a curriculum development and delivery specialist and practitioner, I've spent over 10 years in the school system at both the secondary and post-secondary level. I have worked over 20 years in the sports system as a coach at all levels, a coach educator, and a technical leader responsible for coach education curriculum development and delivery at a national sport organization and at the Coaching Association of Canada. I can't emphasize enough the importance of prevention of concussions through training and education of our coaches working on the ground. Education is the #1 tool for enabling behavior change in our coaches. So if I can, I'd like to make two recommendations just to close this. One is the entire Canadian sports system, national sport organizations, provincial territorial sport organizations, including school sport from community to high performance, need to legislate concussion management training through the NCCP Making Headway or other partner resources to better enable our coaches. We already have 14 of our NSOs, our national sport organizations, that have it as part of their training and certification pathway for their coaches. All levels of government, in addition to Safe Sport, need to have concussion management training as a priority because it is a public health. It's a public health issue. Thank you,
Mr. Nydre.
Yeah.
Thank you. And now we're going to hear from Rugby Canada, Mr. Paul Hunter.
Okay. I usually start off with an apology because of the accent, so happy to repeat should I need to. It's the worrying faces on the translators as they kind of start looking, and is my microphone working or not? So I can't do anything around it, I'm afraid. So just to share an overview of where Rugby Canada comes from. So since 2016, Rugby Canada has implemented their player welfare programme, which targets all the pillars involved in sport, from players to coaches to parents to administrators to match officials. So trying to create an understanding that we all have a responsibility around player welfare in our sport. So Rugby Canada, like many sports, have developed their guidelines. What's been critical in developing these guidelines is it's not been done in isolation. So we've developed our guidelines or looked to harmonise our guidelines in partnership with the Parachute Canada through their harmonisation programme. We're also very fortunate enough that World Rugby is one of the 5 organising partners of the International Concussion event, so we're able to access the research that comes from that event that does influence how our guidelines are created. Rugby Canada also, as we govern our 10 provincial unions, we've mandated that all provincial unions must do concussion management training. That's an online module. Not just that, we also have a rugby-specific module. So we've been able to identify that in rugby, there are 5 areas of concern where we can increase the likelihood of a concussion. So they do get training around the awareness of a concussion, the management, and what to do to report a concussion. But it's also important that we educate people on how we prevent concussions as well. And they're 2 very different pieces. Along with our coaches who have a direct influence with our athletes, we also focus on our match officials who have to manage the games, who have to be able to identify and know what to do in a game should an incident happen. So that's our 2 primary focus areas, although we do understand and are looking to look at how we support the parents and the players as well, and not just work in isolation. We've also, in rugby, looked at the prevention piece and identified that through research and our evidence from injuries, that the tackle is where we see the most amount of concussion-related injuries. So we've now developed a resource that looks at where we introduce tackling to young kids. So we're now in Ontario be rolling out our tackle technique resource. So again, a prevention strategy that supports coaches as well as players on the introduction to tackling. Another piece that we've implemented is a zero tolerance approach to contact to the head. So there is a zero tolerance at all levels of the game, from the professional and international end of the game to the community and domestic end of the game. Should contact happen to the head, there are sanctions. Should repeated contact happen to the head, there are more severe sanctions that take place as well, both on the field as well as off the field. We've also, because we're a large country, that face-to-face contact is very difficult. So we also provide webinars where we look to have ongoing education, which has been a primary focus to our referees about how they manage those dangerous tackles. So seeing examples of dangerous tackles and knowing how they manage those dangerous tackles as well, and providing them with the resources to support them in making those decisions in a game as well. Just along in partnership with the Coaching Association of Canada, we have concussion training around the incidence of likelihood of concussion in the game in all levels of our training and education. So that means that a 2-hour slot on all of our courses is focused on the tackle, ruck, maul, scrum and jumping in the line out. These are the 5 areas of the game where we see an increased likelihood of concussion-related injuries. So when a coach leaves any of our coaching courses, they've had the opportunity to practically try to coach in those areas. The course that I talked about previously that they have to do, the Rugby Ready, the specific, that's the online learning piece. So before they go on the course, they must have done the online learning piece, and then when they come on the course, there's the opportunity to practically apply that as well as broadening out and creating professional development workshops around this area. Another area that we have is we have a free app that helps with identification of signs and symptoms, what to do should they suspect a concussion. It's available bilingually in multiple languages actually, because we're fortunate to use World Rugby, as well as on multiple platforms as well. So we know that players play a critical part to that. We know they're quite technology savvy, so trying to get something into their hands that can help them, give them some very accurate information around concussion. The other piece that we've looked to promote is the provincial health lines. We know that there's often it's parents and there's players looking for somebody to speak to and they're not sure who to speak to. So we try to promote the provincial health lines as a point of contact 24/7, 365 days a year. There is somebody you can pick the phone up to and ask a question that can support some help in there as well. We've also, we believe that as an organisation we wouldn't ask our members to do something that we're not willing to do. So on all our AGMs and midterm AGMs there is a player welfare piece where we have had speakers come in to educate our board as well as our provincial unions executives. That's been Gord Stringer, the father of Rowan Stringer. We've had Parachute Canada come in as well, along with some neurologists, etc. Just trying to increase the awareness of the decision makers in our organisation to make sure that they do make player welfare a priority. So education is important right across the the board. We're also fortunate that we were the only national sport organisation to be sitting on the Rowan's Law Advisory Committee. Obviously, Rowan was involved in rugby, and we feel we have a lot to learn and share from that experience. We've been fortunate enough to speak at many conferences, including education conferences, World Rugby's medical conference. So the focus on concussion in Canada most certainly has global attention, and collaboration has been key for us to develop the resources that we have. So at that point, happy to take any questions or repeat it all again, whichever comes first.
Well, accent, we love the accent. Thank you, Mr. Hunter, Mr. Nydre. Now we're going to have the opportunity to have the questions from our members. We're going to start with the Liberals. It'll be for 7 minutes, and Doug Olofsson will commence with those questions.
Okay, thank you, Mr. Chair. Thank you both for coming. This is I'm very excited to be part of this study. I practiced medicine for almost 20 years. I was an emergency doctor, and actually my first job was in an area of town where rugby was actually quite popular. So got to really hone my orthopedic skills. One of the things I was curious about with rugby, now, you know, you're following the different, as you say, there's things like tackling techniques and everything, things like that. That's been helpful. Have there been any changes in any sort of protective gear in rugby that have had any impact on concussions?
Yeah, it's a great question. No would be the answer. For our understanding, there's not a lot of evidence in there to suggest that the wearing of equipment can reduce the number of concussion-related injuries. Two areas that we believe very strongly can reduce concussion-related injuries are changing the laws in your game. For example, tackle height, zero tolerance, and also a cultural change. So if you were to look at equipment alone, we will find that people will manipulate equipment and use it more as a weapon potentially. So equipment in isolation, to our understanding, hasn't reduced the number of concussion-related injuries. But we do see education and influencing that culture as two key areas to reducing concussion-related injuries. We are seeing an increase in the number of organisations and companies that are selling the answer to concussion with various different garments or helmets, etc. We just don't see the evidence it being there at this point. Whether that evolves in the future, but at this point, there's no requirement for a rugby player to be wearing a piece of equipment that would reduce the likelihood of a concussion-related injury.
Okay, thank you. Now, have there been any changes in the last few years regarding the overall rules of the game, like international standards that have changed to reflect increasing knowledge in concussions?
Yes, absolutely. So we've just seen piloted last year to reduce the height in which contact can happen, and that's correlated across other sports. So we have seen a reduction in concussion-related injuries when hockey made changes to their games. So we are going to be looking to implement tackle height and reducing the tackle height. So we have seen that being effective in other sports. So through global research, we have seen that concussion-related injuries increase when the height of the tackle is up and around the shoulder and the head area. So where we introduce tackling, which is at our U11s, that's going to be below the waist. So how we coach that area and introduce tackling is to make sure that the body height comes down. So we have seen that if you make changes to the laws or the rules of your game, that can reduce the likelihood of concussion-related injuries. The other one being a zero tolerance contact to the head, and zero tolerance meaning zero tolerance. That's also the sanctions have seen a reduction in contact to the head.
Okay, thank you. Now, you had mentioned as well, you in your jurisdiction is people from of different ages playing this. Now, I do know in other sports they have different things that are allowed given the different ages. Like for instance, in hockey, there's no contact or body checking below a certain age. I don't imagine there's such a thing as touch rugby, but but is there is? Oh, there. Oh, okay. Yeah. So I was going to say, is there a minimum? Is there a minimum? Well, I knew there was touch football, but what I was wondering is there an age that certain things are allowed at one age and not at another?
Yeah,
how is that set up?
No, absolutely. So we introduced tackle technique or contact at U11. So prior to that, it's a non-contact version of the game. So it's tag and it's flag as well. So at U11s, that's where we're looking to introduce contact by lowering the tackle height to be at the waist. But at all ages and different levels of the game, from international to professional, there is no contact to the head at any point, zero tolerance approach to that. So yes, we do have a gradual introduction to tackling. Yeah, through our education as well, one of our strong messages to our coaches is not to put somebody in a game if they're not prepared physically and emotionally to go in that game. So it's not a case of throw them into to try as well. So that's where that education and culture piece comes down to us. But yes, there is a gradual approach to introducing people to the game of rugby.
Okay, thank you. How much time do I have left? Okay, thank you. Mr. Nidre, you talked about you have your e-learning module, and it sounds like you've got a very good comprehensive list of people that have helped develop this on concussions. Now, and I know that this part of this is return to play guidelines. And those were developed a while ago, and they're always being revised. Is there any stage of it, or have they incorporated any requirement at some sort of level of concussion that there has to be formal medical evaluation before return to play?
Yeah, absolutely. So that's, again, it's part of the protocol. Yeah, it's guiding coaches to seek medical. To guide the coaches, to guide the athletes and the parents for the athlete or the participant to seek medical attention. So it's not for the, as part of that, managing the concussion. So when they suspect through detection that there's a concussion, the next step is seeking medical attention. So we do guide them that way. And then but the return to play protocol is after that doctor or that medical expertise has released, and then there's a long protocol again that we're aligned with what Parachute has said around how the coach manages that and what is the return to play protocol to bring the athlete right back into the field of play.
Thank you.
Okay,
Yeah.
thank you.
So we'll be moving over to the Conservatives now, and Mr. Robert Kitchen.
Thank you, Mr. Chair, and gentlemen, thank you very much for both being here today, and I appreciate that. We basically have, with the two of you here, we have the coaching aspect of it, and we have an individual sport aspect of things. And although you interact together, you do have separate responsibilities. And I appreciate hearing your comments, because I agree wholeheartedly with everything that you've said. And so on the issue from the coaching point of view, and I'll start with you, Mr. Nidre. You provide that training for our coaches for multiple sports that are out there. Do you have a system, or are you looking at a system how you can monitor? And I realize in today's world with computers, there's a lot easier to keep data collection on an individual and regulate that. But do you have a system like that that you have suggested to the various sporting organizations?
So first, when I mentioned that we've had the number of coaches that have gone through it, we have a database of over 1 million coaches in our database. So those numbers that I pulled, I have more data we can chat about, but that comes from basically what the contents of our national database. So we have 66 sports, and all of their coaches that are linked to those sports, they're all in the database with a full record or a transcript of everything that they've taken. Right. So, that's where I was able to produce those numbers of we know the percentage of coaches, we know what are the highest sports that are making headway. So we track all those things as part of monitoring it.
Now I come from in my previous life from a regulatory point of view. I was the regulator for the chiropractic profession in Saskatchewan as well as Canada.
Right.
So we look at things in regulating professionals. And that's where my angle on that is. Right. Is there an avenue for you to do that? Obviously, there's a cost that would be added to that, but is there an avenue along there where you might see that of value?
Well, it's funny you ask that. So right now we're in the midst of I guess we can call it revamp, or we're in the midst of approving our charter professional coach profession. So again, we are looking at from the charter professional coach aspect as certain different pathways to lead to that. Has making headway or concussion management come into that discussion? No, that I'm aware of anyway. But I mean, those, again, aside from the fact that we can track these things, and we have, I mean, aside from those sports that I've mentioned, you know what, I know that there's other organizations, secondary school, provincial secondary school athletic associations that are tracking this and making it mandatory for their school coaches to have this. You know, that's where we are from a regulatory body at that point. Like, that's not really our role. Our role is education, you know, creating and working with our partners through the.
And so your emphasis is more on that aspect of it, in which case that would then maybe throw it to the individual sports per se to actually regulate within, or their own individuals. Would you agree with that? Would that be the better way of doing it?
Yeah, I mean, again, we're providing the education. We try to guide them. So, I mean, and we keep a lot of statistics on, you know, what coaches report after taking it, to work with our sports to say, you know, what the content that's in there is, you know, it shows that our coaches, from a self-efficacy point of view, feel more confident in managing concussions. But from that point, we don't legislate coaches. We work in the National Coaching Certification Program with our partners. Okay. So
thank you, Mr. Hunter. And I, having been a rugby coach myself at one point, I appreciate your comments on tackling. To me, that is the most important thing. That I learned the game when I was 6 years old in England. And so I grew up from that very day learning how to tackle at that age. And I found that once I came to Canada, that wasn't there, and that we had football players coming to play rugby and not rugby players coming to play rugby. Two different sports, two different differences to it. So I'm glad to hear your approach to lowering the tackling levels, and a hit to a head is a hit to a head. We knew the risk when we played the game, and ultimately it was there. Things, as you said, the ruck is one of the most risky part, but tackling, I believe, is truly that aspect of it. So I'm wondering, sir, do you believe that it should be the individual sport that makes those decisions on how you regulate your game? Or do you see an avenue where the federal government should be regulating you?
It's a good question. I think the sport has a very strong responsibility in prevention. I don't think anyone knows their sport more than the sport expertise, whether that be analysts who tag games and incidents, and that's where we found a lot of our data in terms of knowing that tackle is where we see the most increased likelihood of concussions. That's through our analysts. So I think the sport has a part to play in prevention. How do you change or make changes to your sport? So for us, it's how have we changed the tackle height? How have we implemented laws around refereeing? I think that is where sport has a responsibility, and there may not be too many avenues for further partnership in there. Where I do see the partnership is in the detection of a concussion-related injury, how we manage concussion-related injuries. But if we're talking about prevention, the sport has to look at their own sport, understand where these concussion-related injuries are going, and then evaluate whether that can be minimised. Yes, there's an inherent risk of participating in sport, but our job in our sport is to ensure that we minimise that risk as low as possible, if not to move it. So I believe that the sport has a responsibility to self-reflect and self-evaluate and make changes to their game to ensure that they do have a safer environment for all participants.
Through sport, and we look at hockey now, and today as we see hockey growing up, that we now have trainers involved with sporting organizations, which we didn't have before. We had people on the bench that recognize that. And I know in rugby, when I was at the University of Waterloo and I was playing there, but the reality was we had a trainer that was there to help us. There are multiple professionals that meet those standards and have within their profession standards that recognize sport injuries, and in particular sport concussion training. And those avenues are out there. Recognizing that the the athletic trainer is probably the closest one to that, because other ones are trying to make money.
Sure.
But there are do you see a value in utilizing all of those expertise?
10 seconds? Okay, yes, I do, but I think it's very clear that we have roles and responsibilities. An athletic therapist can detect signs and symptoms, an athletic therapist cannot diagnose. So we have to be very clear on who has the scope of practice to make a medical diagnosis. But however, anyone from a parent, a player, a coach, an athletic therapist can be educated around the signs and symptoms of a potential concussion, but not to make a diagnosis. That's where through our return, when we suspect a concussion, we should be moving them to the appropriately trained medical professionals that can make a medical diagnosis.
Thank you.
11 seconds.
Yes, right on the button. Perfect. So we're moving over to Ms. Hardcastle from the NDP now for 7 minutes.
Thank you very much, gentlemen. And I think we'll keep going on that line, Mr. Hunter, if I can, because you mentioned a key phrase, which is detection of concussion. And I'm sure, Mr. Nebe, you'll have some ideas around this too. So what should our next steps be in terms of whether it's a federal role or a concerted course of action? Because I understand you have education programs, and we've got apps for phones. Where do you get your content? Where do you get your content to detect a concussion or suspect a concussion before we get into the whole idea of what is our protocol once someone has a concussion, right? So I'm just trying to get my head around your idea of that detection of concussion. And just because the limits of our committee here and what we're supposed to be doing and arming ourselves with information and perspective, if you have ideas of what you think we should be looking at or what we should try, as well as what your best practices are, that would probably be helpful. And I like to front load my time with my question, so you can share the remaining time amongst you, just if you want to have a discussion about that.
Me?
Sure.
So where we get information from, I'm sure that the committee's heard that in Berlin, we had the Berlin Consensus Statement, where we're bringing world experts across multiple disciplines in the medical field who have really moved mountains in terms of where they were 12 years ago. And I think between the Zurich Convention in 2012 to the Berlin Convention in 2016, we're starting to see a little bit more consistency, not a huge amount of change. We didn't know what a concussion was 12 years ago, and even now there's some grey area. So I think we're getting a little bit more consistency from 2012 to 2016, which is helping us identify signs and symptoms, for example. So where do we get our information from? We get our information, a lot of our information, from that statement and that convention, and that's the medical experts. How we then localise that information into our sports, that would be the role of the sport and using various other agencies. So, for example, using Parachute Canada to harmonise our process. When a concussion or a suspected concussion occurs, how we manage that can be the same across multiple sports. But how the concussion happens differs within the sport. So that's why the prevention is really, really important. Detection. Everyone that's involved in sport has to be able to detect the signs and symptoms of a concussion, not just on the field, but also off the field. We know that young players will talk to each other, they'll text each other, they'll Google search this information. They're having that conversation and they're looking for education. That education is not there yet to meet those standards. So it's realising that it's not just a coach's responsibility, it's not just a referee's responsibility, but when the person goes home, they're going to speak to their parents. parents. Parents have a responsibility to be educated on the signs and symptoms. Not just being able to identify the signs and symptoms, but what do we do after we've identified the signs and symptoms? Who are the reputable people that we can go and speak to ensure that we get the appropriate medical help? And we're not just talking sport here, we're also talking about returning to learn. So we also have a big piece around mental health. So as soon as a young child has a suspicion of a concussion, they may start missing time at school, they may start falling into potentially debt, they may start missing exams. This has a knock-on effect. So there's more education around how to manage a concussion. So once we've detected that signs and symptoms, we look to pass that on to the appropriate medical practitioners, but we also have to manage that concussion. So there's not just an education piece to be done pre-suspicion of a concussion, but there is an education piece to be done on managing that concussion and what happens post-diagnosis as well. So my recommendation is, how do we ensure that everyone has access to reputable, current and evidence-based resources that can help identify signs and symptoms of a concussion and take them down a path of seeking the appropriate medical help. Teed it up for you.
Yeah, thanks, Paul. So I just want to add, so, I mean, as Paul just said, and I mentioned it in my opening statement, our goal as the Coaching Association of Canada is alignment across the country. So we work very closely with Parachute. We serve on the FPT working group on concussions as well, which has a lot of different representatives on there. So we sit on that. So we're, for us, when you ask about content in that area, we are, aside from what I mentioned around our current module, it is updated based on, as Paul said, the Berlin Consensus.
Hey, if I may interject, I wasn't questioning the content.
No.
Who, the people who develop the content. So you were saying I'm assuming you're an educator, physiotherapist. That's what I mean, like local.
Yeah.
The conference.
Yeah. So again, aside from the conference, again, I mentioned a lot of doctors that were involved in that. The other people that were involved in the creation of it were practitioners on the field of play. So sport technical experts, coaches at all levels of play. I think that's important to understand. And the other, so I mean, that's really the piece where we gather this content from. Those are all the experts that we do. So it's not just the medical experts; it's the coaches or the technical leaders in the sports that understand what the coaches face on a daily basis. So, you know, Paul really hit it well around. It's about suspecting a concussion, and I think the big thing that coaches face as well is the ethical piece, right? Which is around. We have to train. They have to be comfortable with saying, "I suspect a concussion. It's time to remove this athlete from the field of play or practice environment," and that's where they need a certain comfort, because they also feel pull and push from their parents, from the other people in the league or wherever. So I think that's something as well around when we talk about content, and like that's really important to make coaches feel and anybody feel comfortable with saying, you know what. We need to make sure that we're protecting the participant first and foremost, regardless of what level, what competition we're going into, what the practice is, what's coming up. So that's where that's a big piece that we need to make sure that we're educating that. So that when suspect, as Paul said, it should be right to a medical practitioner who's an expert in this area. Because I already mentioned that the biggest population of our coaches are 15 to 24, and then parents like myself that are 45 plus, right? Thanks.
Thank you. So we're going to move back over to the Liberals and Madame Fortier.
Merci. Moi, je vais poser mes...
Thank you very much. I'll be asking my questions in French. If you do not understand French, feel free to listen to the simultaneous interpretation to understand my questions. Testing 1, 2, 3. Testing 1, 2, 3.
T'as-tu commencé le temps?
Have you started the timer? Testing 1, 2, 3. Thank you. Thank you for being with us today. It's a special day today. We know that it's a tremendous cause for the cause. that we're talking a lot about mental health in the corridors and the House of Commons and elsewhere, and we know that mental health is a fundamental issue that's being discussed a lot in the sporting sphere, and concussions do have an impact on the mental health of people, athletes, and our youth who are affected by sporting-related accidents. You spoke of statistics and data earlier. As a committee, it behooves us, when it comes to concussions, to obtain as much data as possible. And if you, Mr. Nidra at Coaching Association of Canada, or Mr. Hunter at Rugby Canada, if you're able to share statistics on the number of players that are affected. You said that there was in fact a drop in the incidence of these concussions, and evidence to back that up would be most appreciated. Now, earlier we spoke of a change in culture. We glossed over it, but I'd like you to flesh that out. We know that there are preventative exercises that are undertaken. There are a number of technical applications. But in your opinions, how can we better change the culture in the sporting realm in relation to concussions? And I'd just like to add that there are athletes and other young people who have come to share their experiences with us at this committee. Stories that were very tough, and they never expected this to happen to them, this change in their lives due to a concussion. And it's been recognised and acknowledged that there needs to be a change in culture. Mr. Nidri, if you'd like to take a stab at that.
Yeah, thank you. So again, just a couple of, I'm just trying to collect my thoughts here. So one is back to your question around, I did read some of the content of the last hearings of the evidence and around the athletes. And I think a couple of things, it goes back to one of my first points around with the coaches. It's again, through the education, we do face, or coaches face ethical decisions all the time, right? So, which can impact these things. And I think through our education of prevention of concussions, it's important to really outline that that the right thing to do from an ethical perspective is when you suspect a concussion, it's time for that athlete to be pulled from the field of play. And we have to continue to do that as a system at all levels. And that comes from a governmental perspective, but it also comes from the sport organizations, national, provincial, local, community-based. So that's to me, that's the first point. The second is, we don't really get involved in the tracking of concussions, but I do know we sit on this. We do sit on the Federal Provincial Territorial Working Group on this, and there has been a lot of chat and recommendations that they've been talking about where this is an important thing to start tracking this more often, especially when you see interventions like education and how that's actually impacting, hopefully, a reduction in concussion management. So, I mean, I can't really talk. I mean, my sports that I come from, they're low risk from a concussion perspective. But again, we do face it as coaches all the time that they can come to practice with that. And my personally as a coach, like I don't take any risks with that. I was a hockey trainer as well, and I never once took a risk around that. So I think that's my big message, is it's around continuing to make coaches comfortable in those ethical decisions around it, or making sure that they think ethically in what and how they are working with their athletes and what they do as soon as they suspect a concussion.
Sure. Great questions. From a national sport organisation perspective, the only time we hear about an injury is there's a claim. That's the real approach. We don't hear around a lot of injury recording.
À vraiment aller chercher les données.
So you don't go looking for the data, you just file the data when you receive it.
We only hear about injuries when there's a claim to that. So we do have in our provincial sporting organisations who do hold data locally, but that generally is not shared with the national sporting organisation. That would be a gap, because where you'd be able to find if we did have accurate data is trends that happen across the country. a lot of data in the rugby context is from other countries. So looking at high school and the age of kids compared to other countries. However, they're not Canadians. That's the best data that we have just now. We in rugby have identified that as an issue. So one of the things that we've just done recently in the past couple of weeks is we've partnered with the University of Calgary to look at some high school data collection and injury recording. So this is something that we have looked at. Why is injuries not recorded? How do we get injuries recorded? What is an injury? At what point is putting a Band-Aid on somebody? Was that something that needs to be recorded? So having a standardised recording. So what one province may record may be completely different to what another province records. What one athletic therapist records might be completely different to what another athletic therapist records. We do have injury recording on our player welfare website that they can access. It's not accessed. Most clubs, most schools and most organisations will hire third-party medical coverage for their tournaments and their festivals. So that's not clear how to get that data or that evidence.
Juste pour vraiment comprendre, à l'intérieur.
Just to get a handle on what you just said, at Rugby Canada, you haven't made an attempt to do your own research. You haven't undertaken a data collection exercise across Canada. Do you think that that kind of thing should be done?
Absolutely. If we want to be evidence-based, we have to understand what's happening in our country. So there are some pockets of good data collection. So for example, we know that there was an 8-week programme in Calgary done, observed by the University of Calgary. In that 8 weeks, female high school players in rugby, 50% of them had a concussion-related, 50% had an injury. 25% of those injuries were concussion-related injuries. So nationally, we don't have the trends, we don't have the data. We are most certainly reaching out, but something that would help massively sports is data collection. There is no cross-collaboration between a school and a national sport organisation.
Thank you. So now we're moving back over to the Conservatives and Mr. Alex Nuttall.
Thank you, Mr. Chair, and thank you, Mr. Hunter, for those questions, as well as Mr. Neer for your testimony today. I actually just wanted to follow up exactly where Mr. Fortier was going on data, and you're from British Columbia, I believe. Whereabouts are you from?
Just east of Toronto.
Oh, just east of Toronto. Oh,
pretty much home.
Yeah, well,
Peterborough, yeah.
Okay, well then you're not from British Columbia, and I had the opportunity to go out to BC. I actually went to the Rugby Canada headquarters, and one of the things that they talked about was concussions, and it was interesting. I went out there about 7 or 8 weeks ago, and one of the places I went to was a gymnastics facility. And what they did was this young man had created an app to track the health of young people. And the Chinese government has asked them to take that app and implement it across all of their schools and all of their programs in terms of their Olympic programs, which are, a lot different than the way we structure ours. Has there been any look at that type of approach where we get all of the organizations, Hockey Canada, Rugby Canada, everybody to say, okay, you know what, if you're going to be one of our specifically elite programs, you need to sign this privacy form that allows us to share information, because oftentimes a great athlete is a great athlete, and yes, they excel in one or two things, but they'll be in many different areas.
That would be a deal breaker if I could use that term. So boundaries that we have is high schools will record, clubs will record, our kids play multiple sports. So a concussion that's recorded in one sport that's going through the stream of the provincial body to the national, that doesn't get transferred across to the other sport. So there are likelihoods of kids going from one sport to 100%. The other.
And when they sign up for your sport, are they and their parents not filling out forms that tell you what their medical history is?
So there is medical history. There's also literature, and I say documentation. It says if you have a concussion or an injury from somewhere else, then report that. It's like many documents. It sits there. However, the point that you made, if there was an app that every sport and school was able to record on, and then that took us through the return to play and the return to learn protocols that identified who are the appropriate medical doctors, medical practitioners, then that would be a deal breaker for us. That would give us very hard evidence for us then to make changes to our sport.
You're saying deal breaker in a good way.
Sorry. Yes,
A deal
absolutely.
maker. A deal maker.
A deal. Oh, sorry. Okay, deal maker. There's a learning
An
for me.
accelerant to moving forward. So
Yes.
that's great. In terms of in terms of today, it's Bell Let's Talk Day. We had some testimony at this committee, which was, I found, like, I almost had tears. I know that you knew everyone. Okay, yeah, and I know you knew one of the families very well. Cheryl did. Sorry, I should say that into the microphone. And the mental health issues, the mental illness related to concussions. What is the data that you're getting out when you see this happening within your sport in individual cases? Is it an automatic link? Is it a 1 in 3? Is it a 1 in 5 where you see depression, real depression, like can't go to school or can't go to work or can't get out of the house depression? Because that's what we heard from two incredibly awesome young people not too long ago.
I don't I'm not aware of the data that really links those two. Again, as Paul said, like we're struggling with just keeping data from sports on the incident of concussions, right? So as Paul said, we do need that a database around who's suffering that, because when we think about all these interventions, we need to see how that is impacting this. So from a mental health perspective, I can't talk to that. Again, anecdotally, I've heard stories, and the thing about mental health as well, as we're all aware of, is that we are encouraging athletes, anybody, to be able to speak about it more. The reality is there's some that don't. So there's some that might even not come forth for wanting to do that. And that's an issue that we face too as part of this. When we're trying to do something that's evidence-based, we're sometimes very limited to those things.
Thank you.
We're going to now be moving over to the Liberals, and this will be the last member in questionnaire for this round, and that's Mr. Darren Fisher.
Thank you very much. Thanks, gentlemen, very much for this. It's going to seem like I'm a little all over the place. First of all, under the Coaching Association of Canada, is Rugby Canada underneath that association? Is that one of your 66?
Yeah, we're partners with Rugby Canada, correct.
Okay, great. So you talked about training. I'm really interested, Peter, in retraining. So I'll use hockey for an example, because that's an area that I know the best. My son had a coach that when he was 5 years old, who's still coaching. Would I be right in assuming that there are regular retraining sessions? Because what we know about concussions now, and a lot of this falls on the coach, what we know now is so much greater than what we knew 12 years ago when my son started playing hockey. So how much retraining? Is it yearly? Does it even occur? And can you even speak for Hockey Canada as to whether there's constant retraining?
So what we do, what we have as a policy in the National Coaching Certification Program is we have what is called a maintenance of certification policy. So what that is basically coaches who are certified in the NCCP must maintain their certification on a 5-year cycle. So every 5 years they must renew it through professional development. So we have a points system. So they take various professional development opportunities to accumulate those points and maintain their certification.
They get the opportunity to do that. Are they held to a standard where they must do that to continue coaching?
So again, that is when a coach, if they do not maintain that certification, they basically their status becomes certified not renewed. However, it's up to the sports to look at how they implement that not renewed status. But I know that hockey is working on how that works with respect to on the bench. And sports are working through what that certified status and certified not renewed status means, which means they are, through their legislation and what their rules are from a code of safety perspective on the bench, that they make sure that their coaches are maintaining their certification. And we notify the coaches well in advance that this is happening. So.
Okay, Paul, in your former role, you were manager of national coach development. So when you're developing a coach, what part of your process of developing a coach for, let's say, youth rugby is focused on concussion? Now, you talked a lot, both of you have talked, and many people have talked about identifying concussion. We hear a little bit less about prevention.
Yeah.
So maybe you can touch on what your role was before you were interim director, and how you would approach that from a concussion point of view.
Sure. So for us, we decided to make our online training annual for the reason that we would never go 12 months without any new information being introduced to a coach, whether that be a change of the law of the game or anything from the medical side. So the two pieces we have is in our training annually online is the Rugby Ready. How do you coach the 5 areas of contact in rugby? So we have a law variation coming in. That means that everyone will not go more than 12 months without that new cycle of those new laws coming in. The concussion management training, that's separate. That's not the technical and tactical of the sport. That is the signs and symptoms identification and management. And so, for example, one of the changes that we have there is there's some research that we've got that there are warm-ups that can equate to the reduction in concussion. So that's going to be integrated into the prevention piece. So we have 2 pieces of online training that will be done annually. So we've mandated that all coaches and players, and our jurisdiction is over the club environment. However, a lot of school boards will adopt Rugby Canada's policies. So many of the school boards are doing it, but we mandate all club coaches and referees must do this every 12 months. So technical and tactical online, as well as detection online. So the prevention piece is supporting the coach on how they can technically coach these areas of the game, the 5 areas within our game. And then the concussion management for the general public is how they would identify, detect and manage the signs and symptoms of concussion.
Zero tolerance.
Yes.
Do you find zero tolerance has an effect on changing behavior? We've seen it in hockey. You know, someone could get suspended for 5 games, come back the next game and get suspended again, do the exact same behavior. We've been told by people here in this room or in a room, in one of the rooms that we've met during this committee, that we've seen it from mothers and heard it from mothers and fathers and young athletes that the penalties do not change behavior. The zero tolerance in rugby, does that change behavior?
Yes. And I don't think there's anything that explicitly is the single answer that will reduce and eliminate. I think there are multiple pieces. I think zero tolerance plays a deterrent part, especially around the deliberate contact to the head. Accidental, maybe poor coaching, poor understanding from the player. But yes, I do believe that you will see a reduction in the height in which you go into a contact. That's an education piece. We asked before, how do we change a culture? That's going to take time to change a culture. We're not going to see an immediate change. But I would say role models play a key part. What our international athletes, what our professional athletes do, role models play a part. So if we see on TV something that is a zero tolerance means zero tolerance, then that's going to filter down to our young kids. So yes, I do believe that a zero tolerance approach to contact to the head does reduce concussion related injuries. I think Hockey Canada have done some fantastic research there.
We'd like to thank Rugby Canada, Mr. Paul Hunter, and the Coaches Association of Canada, Mr. Peter Nydre. Thank you very much. Sounds like you work well in tandem together, and everybody is looking for the best approach to this and how we could find some solutions to some difficult questions. So thank you so much, and to the members for their questions. We're going to have a transition right now into our second round with our next witnesses.
Thank you.
Thank you.
Gentlemen. Thank you.
Yeah, no problem. Thank you.
And it's great. We've got, we just heard from our first witnesses, and now we've got our second round. And from the Children's Hospital of Eastern Ontario, Dr. Roger Zemek, Director of Clinical Research. And from Parachute Canada, we've got Pamela Fuselli, Vice President of Knowledge, Translation, and Stakeholder Relations. And what was great, I say to the members, is both of these witnesses did participate in terms of listening to our first witnesses. And there may be some information that they may be able to impart on us from the questions that they were able to hear. We are going to commence with the Liberals again in this first round, and that will be Mr. Darren Fisher. Will be
present first.
Oh yes, that's right. I did that again. Okay, I just somehow want to jump
repeat.
in right to the questions. We're gonna start. We're gonna start with Dr. Roger Zemek from CHEO.
So thank you again, and I wanted to, as my previous speakers did, thank the committee and the subcommittee for giving attention to such an important topic. I also, before I begin, I wanted to just say that I am a recipient of competitive grants from numerous organizations, including the CIHR, Ontario Neurotrauma Foundation, Ontario Brain Institute, Brain Canada, Physician Services Incorporated, and the NFL, but I don't believe any of these conflict as a conflict of interest. So I wanted to introduce myself. My name is Roger Zemek. I'm a pediatric emergency physician at the Department of Pediatrics at the University of Ottawa. I'm a senior scientist at the Clinical Research Unit, and I lead the Evidence to Practice program at CHEO. I have a clinical research chair at the University of Ottawa in pediatric concussion through the Ottawa Brain and Mind Research Institute, and I'm the vice chair of Pediatric Emergency Research Canada. My own area of research, in addition to being a clinician in the emergency department, my research focus is in the generation, application, and knowledge translation of the best available evidence for concussion, and bringing that evidence to the bedside as well. I have gotten over $4.3 million as the lead investigator on research and as a team member for over $34 million in total concussion research funding. One of the things I'm very proud of is being the ability to have led the team that has done the largest concussion study to date in the world. We did 9 centers across Canada with over 3,000 children enrolled in this study. This study was called the 5P Study, Predicting Persistent Post-Concussive Problems in Pediatrics. I also have studied the epidemiology of concussion to examine the trends over the past decade. I lead a provincial randomized controlled trial of early physical activity as mentioned in the Berlin guidelines versus the previous guidelines, the Zurich, to see which of those two rest protocols are more effective. And I led the first comprehensive concussion guidelines through the ONF for pediatrics. And that had not only a health care provider version, but was also the first to introduce a coach and teacher as well as a parent version. I am part of Pam's team as a parachute content expert. I was on the Berlin panel as well as one of the pediatric expert and on one of the other teams as well. And I have presented to the National Institute of Health in the United States at Bethesda and sitting on some of their expert panels. I'm very proud to say that Canada is a world leader in concussion research. Of the 10 most cited universities across the world with regards to concussion, Canada is home to 4 of those universities. So 4 of the top 10. And so we truly are groundbreaking. And if you were looking at the panel of the scientists who presented at that Berlin meeting and who led a lot of those committees, Canada was definitely hitting above its punching weight. I just wanted to quickly highlight a few quick things with regards to my own research, and then happy again to delve into more detail on questions. One of the things is epidemiology. We've shown that in Ontario, the number of emergency department and office visits for concussion have quadrupled over the last decade, and that increase is most significant in the particularly adolescents, in which they had over a 5.5-fold increase. With regards to my study, that was a 3,000 patient study across emergency departments in Canada. This was really getting children at their most acute times of injury. The average child was enrolled in less than 3 hours from the time of their injury to when they got in the study. And we followed those children up for over 3 months. And what we found was the good news is, there is good news. Most kids get better. About 30%, however, continue to have symptoms that persist beyond 1 month. And what I've done is I've gone over some of those factors that are predictive. I won't go into those details now. We also know that while sport is an important cause of concussion, we know about 25% of all concussions, and even up to potentially a third, happen unrelated to sport. And that is very important to keep in mind because our athletes can still slip on the ice. They can still have collisions in the hallways at school and be involved in motor vehicle collisions, which then affect their sport afterwards. One of the things that our team did was we looked at, we talked about return to play and how those things have evolved, and I'm proud to have led the team that found that early physical activity actually did lead to improved recovery over time. So the concept of home jail, in which families interpreted rest until asymptomatic as keeping their children in these dark rooms for periods of time may actually cause more potential harm than good. And I'd be happy to talk later about finding that correct balance of the Goldilocks, not too hot, not too cold, and us finding that just right. And lastly, one of the studies that we did was looking at the quality of life of children with concussion. And while children with concussion improve in many aspects of quality of life, one of the things that remains very impactful compared to the average child is the impact on school. And as a pediatrician, this is such an important factor. And even in those kids who have recovered, the school quality of life factors remained significantly decreased from healthy children for months on end, and that extends beyond 3 months. So I'm happy to have this opportunity to talk to the panel about something I am so passionate about trying to get some of the answers for.
Well, thank you, Dr. Zemek. And now we're going to move over to Parachute and Ms. Pamela Fuseli.
Thank you. Good evening. As you said, my name is Pamela Fuseli. I'm the Vice President at Parachute, Canada's national charity dedicated to injury prevention. Thank you for inviting me to speak to the committee on this important topic. The purpose of this subcommittee aligns well with Parachute's vision to ensure Canadians live long lives to the fullest. As we reduce the incidence and long-term impact of concussions, Canadians can get back to participation in sport and their day-to-day lives. Parachute acts as a bridge between research and policymakers, the public, professionals, industry, translating research into key messages, tools, strategies, and policies. Basically, who needs to know what, how, where, and when. We also have topic experience. We've been undertaking targeted work at the national level, supported by federal funding from the Public Health Agency of Canada, in collaboration with our partners from Sport Canada, in education, health, government, and in consultation with our Concussion Expert Advisory Committee that is comprised of internationally recognized clinical and research professionals. So what are our recommendations that can inform this subcommittee's work? First, national uptake and implementation of best practice guideline and tools. We've already made excellent advances to improve concussion education, recognition, prevention, and management in Canada. We have strong foundational documents for a harmonized national approach based on the International Consensus Statement on Concussion in Sport, such as Parachute's Canadian Guideline on Concussion in Sport and a harmonized concussion protocol template. In addition to being evidence-based, it's critical this approach is comprehensive, that it emphasizes pre-season education and prevention, and that it be embraced within the culture of a sport organization. Since 2017, these documents have been adopted by over 40 national sport organizations, as well as a number of provincial organizations and schools. We don't need to reinvent the wheel, but we do need collective support to ensure use of these expert-informed best practice resources by everyone. Second, training for medical and healthcare professionals. Concussion education for healthcare professionals is required. It's essential for them to be knowledgeable of the most current clinical practice recommendations. For example, proper assessment and guidance regarding gradual return to activities. Parachute is sharing the latest and best information through the Concussion Awareness Training Tool for medical professionals, a free online accredited training course that ensures information gets into the hands of experts. The potential implications of a missed or poorly managed concussion makes proper assessment and management essential. Third is education and awareness. The public is both focused on and confused with concussions. There are myths that are still perpetuated, as well as a sense of fear that every concussion will be life-altering. Youth and their parents need current and credible information with clear actions that they can take themselves. Parachute developed a suite of concussion fact sheets and a mobile app called Concussion Ed to help families understand the signs and symptoms, identify red flags that require immediate urgent medical attention, and steps to help manage a concussion. There are also tools such as the Canadian Concussion Collaborative's 4 characteristics of a good concussion clinic that helps families assess where they are obtaining care from. This education needs to be to many audiences. It needs to be sustained and ongoing, contain relevant facts and actions, and ensure that this information sticks. The 4th is research and evaluation. Knowledge about concussion has increased, but there's still much we don't know, especially about prevention. Canada is a leader internationally in the field of concussion, and increased long-term funding to support research will help our leadership continues. Many of the interventions currently being implemented do not have adequately resourced evaluation plans to understand the impact or not of the interventions and how to best meet the needs of various audiences. And 5th, beyond sport. While much attention has been on concussion in sport across all age groups in Canada, the majority of concussions are sustained through falls, motor vehicle, and daily living. Individuals who suffer concussion outside of sport participation also need guidance in their recovery, but may not receive attention because of the focus on concussion in sport. We need to bring greater attention to populations that we rarely talk about and those that live in rural and northern communities to ensure that they are receiving timely, equitable, qualified, and cost-effective medical care. These recommendations apply across the country in every province and territory. There's a significant need to strategize to reduce the fragmentation where some jurisdictions have been quite successful in developing standardized sport and school protocols, as well as clinical pathways that ensure patients are receiving the highest standard of medical care, while other jurisdictions have not. I believe and hope that this information will be valuable to inform the subcommittee's final recommendations. Thank you.
Thank you, Ms. Fusili. And now we're going to move to questions, and we are going to commence with Mr. Darren Fisher from the Liberals.
Thank you very much. Thank you so much, folks, for being here. Pamela, you spoke so quickly. I was scribbling things down as fast as I possibly could. That's okay. You had so much. You have a wealth of information you wanted to get out in a short period of time. Tell me a little bit about this bridge. You talk about yourselves being a parachute being a bridge between research and policy. How does that work? Can you give us a little bit of an example of what that looks like?
Sure. So knowledge translation is founded in theories and principles about asking who needs to know information, how they need to receive it, when, where. One of the roles that we play as that bridge is to turn language and findings from research that is not accessible to all audiences into either lay language or turn that into strategies that can be used with various audiences. So whether that's to inform what a policy looks like, whether that in some cases, is an industry change that needs to be made, that their key messages or actions to parents. So not everyone is going to read published manuscripts of research. And so our job, my job in particular, is to understand what the research is telling us, what the leaders in Canada and internationally are saying about concussion, and to make sure that that gets translated into action. So, for example, Dr. Zemek talked about the changes in terms of activity levels. So we want to make sure that that information gets into the hands of parents. It gets into the hands of medical professionals that speak to parents. So some of our role is to arm sort of an intermediary, whether that's a healthcare professional or a policymaker in terms of what communication that they are doing out to the people who really are who we are trying to impact with that research.
You talked about the importance of uptake of best practices. Is that best practices, I assume, for identifying, preventing, and for the treatment? You also mentioned, and I know I'm going to run out of time, but you mentioned a poorly managed concussion. So maybe you can tell us a little bit about the success of uptake of best practices and talk about maybe what a poorly managed concussion would look like. And I'm sticking with sport. I was surprised and amazed by your point that most concussions happen outside of sport. I just always associate them with sport.
For youth, it is sport is the leading cause of concussion. For the rest of us, it is other things. In fact, we're seeing an uptick in concussions from seniors falling, but that's for another day. So, in terms of a poorly managed concussion, I may defer to the physician. But in terms of best practices, talking about what it is that will make the best impact on that individual. So, making sure that the information that we know about activity levels, the amount of rest that's needed, the amount of screen time or not screen time, how to return to activity but not particular sporting activities. So making sure that that concussion, once they happen, are managed appropriately, meaning employing the best information that we have for the best outcome, so that we have those majority of people who have suffered a concussion recover within a period of 2 to 4 weeks, depending on how old you are, versus having the longer term concussion symptoms.
Is there good uptake on best practices?
It's certainly getting better. The difference, I think, in the last 5 years in terms of how we are talking about concussion. And Dr. Zemek talked about the increase in concussions reporting. Some of that is that there aren't more concussions happening, but more people are aware of the fact that concussion is a big issue and that they need to seek medical attention. And so in some cases, those increased numbers are good news for us because that indicates the information is getting to the right people.
You said youth and parents need to have good quality info, but youth and parents probably don't know very much about concussions until they get one, or they get another one. They probably go right to the internet. They probably start searching, panicking. Is this a concussion? Do you have trying to figure out exactly how you talk about you work with the medical and the healthcare professionals. How do we get to the point where someone in Adam B. Hockey and Dartmouth Cole Harbour has the ability to get that good quality info when the first thing that they do is go to Google and look up concussions and get God knows what?
We're actually working on that in terms of the Google search engine, and I am not a technical expert by any means, but in terms of how the information that is most credible comes up in the Google searches. So number one, if they go to Google, that they actually find good quality, credible information. And I think it's multi-pronged. There's never, unfortunately, one magic solution. I think it's a time issue as well. We know from other public health issues that it takes a while for this information to get down to all levels in the country. But a sustained multi-pronged approach, I think, is what is the most effective. So working with our partners like Coaches Association and the different NSOs, the provincial organizations, the schools, the provincial and territorial governments, healthcare professionals, just getting it out there. One of the roles of Parachute is to talk to the media and to the public at large. And so we do a lot of work on social media, on various channels, but targeting that message to the people who are on those channels in particular. So Facebook would look very different from a tweet and so forth. And so it's multiple channels, multiple layers, and it's sustained and over time. And I think that's the most important thing, is to see that everyone is armed with the most credible and current information so that they can be those conduits out to everyone.
Fabulous. Thank you very much. Thanks, Mr. Chair.
I'll be moving over to the Conservatives now, and Mr. Kitchen for 7 minutes.
Thank you, Mr. Chair, and Doctor and Ms. Fuseli, thank you very much for coming here today. Appreciate that. And I'm going to actually follow a little bit more on what Mr. Fisher was mentioning on the reality of rural Canada and where do we deal with that. And some of the greatest hockey players in Canada came from Saskatchewan. I will defer to him on one of the greatest but with two, I'll give him that. Yeah, they're both good. But with that said, that's an argument for a later day. But a lot of times what we're seeing in rural Canada is practitioners who aren't trained and don't have the skill set to make the diagnosis, to do the assessment. Just because I graduated from chiropractic college, medical school, came from physical therapy or whatever, doesn't mean that put a doctor or whatever in front of my name, does not mean that I'm an expert in this area. And a lot of these professions do have certifications that recognize those aspects within themselves, and so they regulate themselves along those lines. But it is a big challenge when we see somebody who comes into, and having spent 30 years in practice, having someone come in and say to me, yep, I've got a concussion. And when you ask the question, well, do you really have a concussion? And ultimately, you ask them to describe it, because the physician says, I've got a concussion, went into the boards, therefore I have a concussion. But no one asks them the question, well, how did you go into the boards? And, well, I fell at the blue line and I slid feet first into the boards and snapped my head. Doesn't necessarily mean I have a concussion. I have symptoms that are very similar to concussion, but more than likely, beyond diagnosis, I might have whiplash as opposed to a concussion. And so that's a big challenge. And I'm just wondering, how do we help Canadians in rural Canada where we don't have those skills? We might, but we don't. And how do we help that so that our constituents and our population is being looked at, whether it's hockey, rugby, or whatever the sport may be?
So, excellent question. Thank you very much. And it's one that all of us who are diagnosticians, that's what I do in emergency medicine. I come in with someone who doesn't yet have a label. I have this. We have to come up with that. So it's an issue we face every day on all these diseases that we see, including concussion. I'm going to answer your question in two ways. First, about what we can do now, and number two, what we can do to the future to help that. So what we can do now is, again, this is where it's so important that we have high quality evidence informing guidelines that then get in the hands of the people that need to do that. And as part of either the Berlin, the Parachute, or pediatric-specific Ontario Neurotrauma Foundation guidelines, all of them have sections on how to make the diagnosis. And so, as the speakers prior to our group alluded to, some of the roles sometimes are for people to, within their scope of practice, to suspect concussion. And then some of it is to make the diagnosis. And I think for some of the concussions, they're going to be clear. There is a definite concussion. There was a witness loss of consciousness. The brain was definitely involved. In children, as a pediatrician, I see this all the time. What happens to that 2-year-old or 3-year-old that, skating for the first time, fell, hit their head? Now they have a goose egg. We know they hit their head, but did it affect their brain? Some of the tools that we use are not necessarily valid in that age group. The communication skills may not be best for that child to even communicate, or same with the elderly. I know the goal for today is to focus on sport, but that certainly happens I'm sure you watch any sporting event on TV. There was a collision, player goes down, from watching on TV, did that, we know that person hit their head, but did it affect their brain? And that's what you need for a concussion. It must be a brain injury. And you don't have to always hit your head. The collision can be to elsewhere in the body, and the energy can be transmitted in that whiplash type motion. So with regards to that, it's saying, is it definite, possible, probable are all things that you can think about, but in lack of better evidence to help us differentiate those, the management at this point for concussion is still the same. So conservative being prevent no harm first, do no harm. You don't want that person going back to an activity where they're going to re-injure themselves. So I think the first and foremost, whether it's still possible or definite, is to make sure that they do not engage in another risky behavior within a period while the brain is not recovered, as to prevent the tragic outcomes of what happened to Rowan Stringer, as we've discussed earlier. So I think that's number one in the management. With regards to further diagnosis and clarification, again, those are all things that there are concussion tools that exist, either the CAT tool that we had talked about earlier on how to train. There are guidelines that these providers can use, and those are all things that we need to just make sure that is part of the regular maintenance of certification. The second part of my answer, not to take up too much time though, is we still are lacking that objective biomarker. There is no blood test. There is no saliva test. There is no picture test. There is no even eye tracking or pupil size or balance test, none on its own yet, that exists that can objectively diagnose concussion. And this is something that many people are desperate for. Especially even outside of sport, the military. If there's a blast and someone's thrown, and now they're having symptoms. Well, was it a concussion or is it PTSD? The symptoms are very overlapping, and with regards to that, and that can happen in concussion. Children who had a bad collision and a bad concussion, months, weeks on, can still have symptoms again, which are the concussion and which are their other types of related sequelae of having an injury. And so one of the things that we need is more research to find these objective biomarkers. I know there is a global effort among many groups to come up with that blood test or picture or other sort of validated measure that can accurately distinguish those two groups. But that's something that as scientists we have more work to do.
Thank you. We're going to be moving now to Ms. Hardcastle from the NDP.
Thank you very much, Mr. Chair. Thank you very much to the both of you for your very meaningful input here. I guess what I want to do is start off with you, Dr. Zemek. If you can talk to us a little bit about, I'm sure you've had a chance to read some of the other testimony. And just over the Christmas break, a race car driver by the name of Dale Earnhardt Jr. Released a book in the fall called Racing to the Finish. And it specifically addresses that he didn't have a traditional concussion, but that his brain swished around, so to speak. And but this latest book that he did is dedicated to mental health. Some of our testimony was about the gaps between the physical and mental health when you're seeking treatment. And I wonder if you see some, what we would call strengths, weaknesses, and opportunities, and what our role and our recommendations might be able to focus on.
So thank you again, especially on today's Let's Talk Day. It's so important to recognize the mental health implications of concussion because they are there, and it is something that we have continued to study to better understand. I think there is still we have to be very careful how we use the word cause. We have to use the word association at this point because we don't know yet which is chicken and which is egg. Is it the fact that people who have predisposing mental health or would be going on later in life to have mental health related illnesses such as anxiety, such as depression, or other associated mental health problems, are they more likely to have ongoing mental health symptoms after their injury? We do have research that indicates that that may be an association, not with regards to their physical symptoms, but with regards to their ongoing mental health symptoms. Or is it the fact that the concussion has now triggered and exposed this? And there's many things in life where an exposure changes your DNA, and you can have your DNA changed by exposures, and that's what causes many illnesses. So is there something with regards to the injury that has changed the brain either through DNA or through blood flow or others? And that's something that we still need to work on. So I think that's an opportunity to study. I think with regards, do you have a follow-up question? Yes.
I just wanted to clarify maybe a little bit more practical about what is happening right now. Some of the testimony we heard about how a patient seeking treatment for an alleviation of symptoms that are physical, are mental, and they could be or could not be linked. But then when you're pediatric, it's dealt with one way, and then you reach a certain age and it's dealt with another way. I thought maybe you'd be able to give us a little bit of practical areas that we can be focusing some of our attention maybe for the future.
So as a pediatrician, I can't really comment too much on how the adults manage their patients. Again, my area of expertise is that. I can say, though, that as a scientist, we still have so much to understand on the actual, and I'm going to answer your question through the science. as a science, we still don't know what the physiological true recovery time is. And that is so important as to help our patients who have concussion, because if we had a better understanding and we could say with, again, an objective picture to say, yes, the concussion part of your injury is over. Now, all that remains is this other process. Or we still have the picture that shows, yes, the parts of your brain that get changed with concussion are still there 3 months, 6 months, 1 year later. That can then help us to say, does the treatment have to differ? At this point, there is no evidence to say the treatment of ongoing mental health problems, be it anxiety or depression, for concussion have to be treated differently because it's concussion as compared to a child without a concussion. Currently, the medications and the treatments are the same. What's important is that recognition that this child is at that, and the recognition that concussion may be associated with an increased risk.
And with that, we know that there's still a lot of research that needs to be done, but you also heard testimony previous that we need to address data collection as well. I thought maybe, did you think there might be some opportunities there that we should be meaningfully exploring as if there is a federal role or a government role? Do you see how that can be orchestrated? Maybe let's let Ms. Giseli go first, and then you can go ahead.
Yeah, I think it's a challenge across injury issues, but certainly for concussion in the way that that data is collected, we always see the tip of the iceberg. So I know at the FPT working group, we have talked a lot about what systems already exist that could be leveraged to collect the data that is out there. What are sport organizations collecting, and how can we access that or not? What are the barriers and facilitators to that? It is a challenge across the board. I don't think any country has sort of solved this issue around access to get a clear picture about the number and severity, and as Dr. Zemek said, the period of times that concussion can take in order to understand the real picture of the burden of the concussions in Canada. And so I would say that as part of that research and evaluation, that is an essential component that we are missing in terms of understanding the data very clearly. Now, data will tell us one thing. It will tell us how many. In prevention, what we also need to know are the contextual pieces of information to understand about how the injury occurred, because by knowing that, we can direct the prevention strategies, and that we are not looking for solutions that aren't even part of the problem. So I would encourage both numbers collection in terms of absolute numbers, but also contextual information so that we can understand what solutions can be put into place.
Thank you. We're going to be moving now over to Madame Fortier for the Liberals.
Bien, merci beaucoup. J'apprécie beaucoup.
Thank you very much. I was pleased to hear Cheryl ask her question, so I'd like to give you an opportunity to flesh out your ideas on how, as a federal government, we can undertake analyses or make recommendations. And if you have any other ideas as to topics that we should study as part of our study, I'd love you to tell us about those too.
Well, thank you, merci beaucoup, for the question. With regards to how we can better measure, I think it's so important that we have an opportunity to better link all of our distinct provinces and territories. People will ask me how common are concussions in Canada, and I have to say, well, they're this common in Ontario, this common in Alberta, this common in this province, and I am jealous of countries like Australia, where they have a national insurance number, and all the billings and all the information for healthcare visits for the country are on a national level, whereas for all of our numbers are, you have OHIP for Ontario, RAMQ for Quebec, etc. So as a scientist, we don't know, is there differences across jurisdictions? So if I had a magic wand, that would be one way I would love to do that. And further, and as Pam said, it'd be great to those to detect, but that helps us to detect those through the ways we can detect. And one of our panelists has many years of chiropractic. We don't have an ability, a scientist, to look and see how many of those visits are covered, or those through physical therapists or occupational therapists or athletic trainers who are also such important partners in this interdisciplinary care that we provide, because those numbers aren't tracked because they are not part of a provincial billing records. So that would be another magic wand to see, is there a way to systemically track those who don't go through the traditional emergency department or family medicine first. With regards to other things we can study, there's so many things that I think as a priority to study. I think the first thing, I'm a pragmatic person, I'm an emergency physician, I would love to know what's the best treatment. We still have no treatment yet for concussion. And what are the promising pharmacological and non-pharmacological treatments? So pharmacological meaning what medicines can we give to address the mental health, to address the headache, to address the dizziness? Or what are the non-pharmacological? We talked about earlier the care that may not be good. This is a bit of the Wild West and a bit of, at times, snake oil salesmen who are purporting sometimes therapies that have not been evidence-based, be it through lasers, through hyperbaric oxygen chambers, taking money from people who are desperate. We learned of all these people who are desperate to get better. And if you have thought that there was going to be a chance that this would work, people may be spending their money on something that is as good as snake oil. So I would love to have evidence to show what works, and also to prove what things don't work, so people don't spend and waste their hard-earned money on things that aren't going to get their child better, and allow them to focus on the things that do, and recognizing not all of them have to be pills. They could be physical therapy or other avenues, mental health care, etc., that may lead to better recovery.
Merci. Madame Fuseli, voulez-vous rajouter?
Madame Fuseli, would you like to add something?
I think I would only add that, the clinics that we see being very effective, and as Dr. Zemek said, that multidisciplinary approach. And so are there models that work, that have that multidisciplinary approach or framework that can be replicated, that whether it's physically located in the same area and in the same space, or that the patients have access to that. I think that is one of the promising practices, I think, that we're seeing in a couple of areas, like Concussion North in Barrie and at the Pan Am Concussion Program out in Winnipeg. So looking at some of those, but also looking at, I think, holistically, concussion as a whole. It doesn't really matter once you have a concussion where it came from, whether it's from sport or something else. The treatment and the return to your daily activities, including sport, is the same. And so I would encourage putting a framework around concussion as a whole, and how do we approach that so as to not leave out those who have sustained a concussion in other ways other than sport, but want to return to sport, have access to that medical information and care. We hear anecdotally that they don't see a sport concussion clinic as somewhere where they can go for care, nor are maybe accepting patients because they are truly just focused on the sport piece.
About a minute.
OK, je vais retourner.
I'll just turn back to something I already mentioned. Earlier you said that the Intergovernmental Conference's government organisation had considered developing initiatives with guidelines. Ms. Fuseli, you referred to them earlier. Do you know whether the provinces and territories are in fact following up on the recommendation that you alluded to earlier?
In terms of adopting the guideline and protocols?
Oui.
Some are. Manitoba Sport has required that all of their provincial level sport organizations, build a concussion strategy and protocol around the guideline and the protocol template that we developed for the national level. One of the goals for us was to, even though we were working with the NSOs at the national level, that any tools that we produced could be used by any level of sport. So we have seen that uptake in Manitoba. Ontario is currently pursuing doing the same. They've got a bid out right now to create some resources using the guideline as one of the appendices that anyone who is going to do the work on the bid must use. So we are seeing that uptake.
Thank you.
Merci.
So we're going to move over to the Conservatives, and Dr. Kitchen, you're on.
And thank you for your comments. And I agree, in the perfect world, everybody, healthcare would be attached to one, and particularly in sport. And we heard that from our coaches as well as from sport specific, where you could track that, because we see in rugby someone has a head injury, doesn't necessarily, they then go play hockey in the wintertime, and there's no tracking of that. And even when the sporting organizations ask that question as they sign up, 9 times out of 10, it's purely a formality, and that piece of paper is put somewhere it's not. And I'm not a data collecting type guy or computer guy, but I realize there's people who have those skills to come up with that. Ms. Fuseli, my understanding is that Parachute has an app, but my understanding, and correct me if I'm wrong here, is that app more of an educational app than actually a tracking app?
Yes. In fact, the purpose of the app was very specific to be what we called an on-the-go app. So access to quick, short pieces of information that could be accessed from a mobile platform at a time when that information is needed. So not to track the injury, because our expertise is not in medical tracking or any of that kind of data. We also did not want to have to house and protect personal data. So the concept of the app was to fill that on the go at the point of when you need that information. And so it's key information about prevention, about signs and symptoms, about red flags when you need to go and seek urgent medical care. And it can be used by coaches and parents and educators. There is what we call a calendaring option, where the parent can assess on a day-to-day basis based on the symptoms of concussion on a scale, on a range of, how good or bad those symptoms are, so that when they go to talk to the physicians or their medical professionals, they can sort of report, well, this seems to be getting better, or this new symptom came up 4 days ago. And so it's more of a calendaring app or tool versus a tracking tool.
And I'm a big believer in education. I believe that education, the more we can get out there to our parents, to our coaches, to our trainers, such they're aware of that. The risk you have is that, as we practitioners have seen, you'll get someone who walks in your door and they've gone on the internet and they've seen something and they've got that symptom because they saw it on the internet, or their next door neighbor had the same symptoms. And oftentimes, while Fred next door may have it, doesn't necessarily mean that you have it. But with that said, Dr. Zemek, you've talked, and I'm so happy to see you talk about injuries that 25% of concussions actually are outside of the sport realm, which is good, because we need to recognize that for the general population as well. And I mean, I'll throw my wife under the bus here, because she tripped over the blue line and hit her head when we were in one of our practices with our kids and didn't have a helmet on. So those you do see that, and unfortunately for her, she suffered a concussion, and it had a huge impact on her for a good 3-4 months. Those are big challenges that we have, and you mentioned that the good news is that people are getting better. You talked basically about 3 months, if I remember correctly, that's a time frame. After that 3 months, what percentages, or do we know what percentages go past that 3 months?
So thank you for the question. I'm an expert in the pediatrics, so I'll focus my comments on pediatrics because, again, I'm not as familiar with the adult literature. We recently published a study in JAMA Pediatrics, which looked at the natural progression of recovery of concussion. Again, we're using our cohort of children who had their injury within a few hours. The good news is most kids, depending on their age, so there's two factors, it's their age and their sex. Most kids recover in the first week or two following their concussion, with the exception of teenage girls. Teenage girls take about 4 weeks to start that. If most of the recovery is going to happen, it's going to happen in 4 weeks for them. Beyond that, unfortunately, it seems like the recovery fairly plateaus. So we know that 1/3 of children are still symptomatic at 1 month, 30%. About 20 or so percent of people are still symptomatic at 3 months. So the recovery curve, although went very quickly down in those first week or 2 weeks, depending on your age and that, it does flatten out over time. And that's when we need to come up with these better ways to figure out how to best treat them. Is it, again, interdisciplinary manners, or is it focused on their symptoms, or are there ways for us to better detect what are we treating?
Thank you. And our last questioner member is going to be Dr. Olfsen for the Liberals for 5 minutes. Dr. Olfsen.
All right. Okay. Well, thank you very much. Thank you both for coming, Dr. Zimic. I liked hearing your perspective. I guess you were here when I was in the early part. So much of my career was in a community hospital that saw children and adults. The last 8 years I was at a teaching hospital that saw exclusively adults. It was a good point you said about how the number of concussions that are not sport related. And, in our practice, I admit whenever we thought concussion, we thought sports. And we worked in the inner city and we saw all sorts of blunt trauma assaults, and you're treating them. You're not thinking of concussion when someone has been robbed of their wallet. So it's a good point that I think medical education needs to really step up in recognizing this. I was also disappointed when you, not disappointed in you, but disappointed when you said there's no, magic bullet imaging. I was hoping you'd say we now have a magic imaging bullet that could say, yeah, this is concussion. And, but there still isn't one, and it's still elusive. But now one of the things about imaging is, this is something that's starting to come up now. Is we do know that there's a lot of imaging that is not useful, but we also know in the early days of the CT scanner, we did it a lot. And we didn't think there was any harm to it. It wasn't until later studying in radiation, we realized that, there probably is an effect. And 30 years out, a lot of clinicians are biting their nails over what's going to start sprouting from these CT scans 30 years ago. Have you been tracking any data with concussions in regards to those who've been inappropriately imaged over time? And are you seeing any trends into more responsible or conservative imaging?
Question, because again, as we talked about earlier, you don't want to do harm.
Exactly.
And we do know that radiation can potentially increase your risk of harm, of future malignancy, and in the growing brain, potentially even effects on IQ. The good news is in Canada, as compared to our neighbors to the south, because of the type of medicine that's practiced and less risk of litigation and less defensive medicine, we are doing very well with reducing the number of unnecessary CT scans. And there are studies that have shown the number of CTs that have been done have significantly decreased up to the point for our study, the rate was only approximately 1%. Which is a very, very low rate of CT scans, and some of them are certainly indicated. So I think with regards to CT imaging, which has the worrisome radiation, that is one thing that we can say we've made great progress, and that is one thing in our comprehensive concussion guidelines we address. So we include recommendations on when should a CT scan be done or not. MRI is a different type of picture that does not have radiation. An MRI is done by magnets with no risk of those X-ray or radiation effects. And unfortunately, MRIs do not show routine changes with concussion. One caveat is there's now some experimental protocols, and I'm involved in some research that is undertaking some of those studies as well, so full disclosure. There are some advanced MRIs that are looking at the way, without getting too technical, just the way the water moves through the brain, etc. Terms like ASL, DATI, and the whole alphabet soup are ways to see, are there ways to better see how the brain changes with concussion? And what we're doing is also comparing those to kids who are either normal or who have had other types of injuries, like either ankle injury or other. There may be some promising ways using those advanced techniques to do that, but they're experimental. And if you were to go to your community hospital tomorrow and say, I want that scan, first, they wouldn't have written the code to how to program the computer to do it. And second, there wouldn't be a radiologist who has the expertise how to interpret it, because it's not a clinical test yet. It would be a neuroscientist who has studied those and would do that. So my hope is, in time, we may have some opportunities to use imaging, either through advanced MRI or there's other even more novel things, FNIRS, which is functional near infrared spectroscopy, which are just little probes looking at how one probe light, so without even having to be in a scanner. Are there other things that we can use to better detect the brain changes that we can't see or test on our physical exam?
Thank you
very much.
Thank you. And I'd like to thank again Dr. Zemek from CHEO and Ms. Fuseli from Parachute. Thank you for your insight. Thank you for helping inform this committee and the analysts, which will be putting a report together for later this spring. Also, that those may be following these proceedings here online or over the television. If we have a number of sports organizations that have participated, have been here as witnesses, but there are so many others that may want to make a submission. You could do that through our web portal, that you're able to make a submission to this committee to help as we put our report together. So thank you to everybody. Thank you to the members, and that will conclude our hearings for today. Thank you. This meeting is adjourned.